Today we are going to study about hypermetropia. Hypermetropia or long sightedness is a type of refractive error in which polar rays of light coming from infinity are focused behind the retina with accommodation is at rest. In normal eye, the polar rays of light coming from infinity are focused in sensitive layer of retina. But in hypermetropia, the light rays is coming from the infinity are focused behind the retina. Etiology or causes axial hypermetropia. In this condition, total power of the eye is normal. About 1 mm shortening of anterior posterior diameter of the eye result in 3 diopter of hypermetropia. If the eyeball shorten in 1 mm diameter in anterior posterior diameter, the eye result in 3 diopter of hypermetropia. Next one is curvature hypermetropia, the condition in which the curvature of the cornea, lens or both is flatter than the normal, decreased in a refractive error. So, this curvature hypermetropia is caused due to the flattening of cornea and lens or both. About 1 mm increase in radius of curvature result in 6 diopter of hypermetropia. In index hypermetropia. Next one is index hypermetropia. Occurs due to change in refractive index of the lens in older age. This is due to the refractive index change. Next one is positional hypermetropia, the result from posterior placement of crystalline lens. Then absence of crystalline lens. Either congenital or acquired leads to aphakia, a condition of highly hypermetropia. If the absence of crystalline lines from the pupillary area is result in higher hypermetropia. Next one is consecutive hypermetropia. Overcorrection myopia follows a refractive surgery. If it's caused due to the refractive surgery is caused in overcorrection of myopia can cause the hypermetropia. Then next we are going to study about the clinical types. There are 4 clinical types: congenital hypermetropia, simple hypermetropia, pathological hypermetropia and secondary hypermetropia. First one is congenital hypermetropia. It is not common condition. Congenital hypermetropia is present since birth. Magnitude of refractive error is highly and often remain constant. And simple hypermetropia, it is a commonest form due to development of axial and curvature hypermetropia. And pathological hypermetropia, it is occurs due to abnormal development of eye, microphthalmia, congenital posterior subluxation of the lens and congenital aphakia. And secondary hypermetropia is next one is saline hypermetropia, positional hypermetropia, aphakia, consecutive hypermetropia, acquired axial hypermetropia, acquired curvature hypermetropia and functional hypermetropia. Components of hypermetropia. First one is total hypermetropia. It is a total amount of refractive error which is estimated completely cyclopedia. Latent hypermetropia and manifest hypermetropia. Then we are going to study about what is latent hypermetropia. Implies a amount of hypermetropia about 1 diopter which is normally corrected by the ciliary muscles. The degree of latent hypermetropia is a high in children and gradually decreased with the age. And manifest hypermetropia, when is not corrected by the ciliary muscles. Facultative hypermetropia, absolute hypermetropia are causing. Thus, total hypermetropia is equal to latent plus manifest or facultative plus absolute. And symptoms: asymptotic, asthenopic symptoms, defective vision, sudden blurred vision, crossed eye section. Signs: eyeball looks like small, Cornea is small, anterior chamber is shallow, fundus examination shows small optic disc. Complication, recurrent style blepharitis or chelation, accommodative convergent squint, amblyopia and glaucoma. Investigation can be found through retinoscopy, autorefractometer and A-scan ultrasonography. Treatment for the hypermetropia is spectacle, contact lenses, laser thermal keratoplasty, hyperopic LASIK, conductive keratoplasty. Thank you.